Welcome back to the TMDSAS podcast. Today we are joined by Ms. Shannon Gutheil, and she is an advisor at the UT Austin Health Professions Office, and we're very pleased to have her because she's going to be talking to us about some very important topics related to managing stress and anxiety as a pre-med and also application for what that might look like later on in medical, dental, or veterinary school and in practice. So these are some very important topics. Ms. Gutheil, thank you so much for joining us today.
Thank you, Enrique.
So for our listeners to get to know you a little bit better, would you mind giving us a little bit of background into your education and your experience as an advisor?
Yes, I have my Master's of Education degree in Counseling and Career Development. I'm also a licensed professional counselor. I have 8 years of private practice in mental health, as well as 6 years as an advisor, pre-health advisor here at UT Austin, as well as the JAMP program manager.
Awesome. So you are exactly the person we want to talk to. All right. Well, let's go ahead and dig right into this topic. We have, I'm sure we've experienced interacting with several students that have a lot of anxiety and a lot of stress. I'm sure a lot of our applicants right now are feeling a little bit of that, trying to hit that submit button on the application or waiting to hear back from some of the schools on their decisions. So we wanted to talk to you about how we can identify or figure out the causes of stress and anxiety.
Okay. Right now during application cycle and also preparation for application cycle, being able to focus on student wellness, stress management, and self-care is crucial. Being able to tune into how you yourself manifest stress. That can be, some of the symptoms of stress could be cold hands, headaches, shortness of breath, sleep disturbances. It can manifest as anxiety, a lot of different ways, and it's different for every person. So being able to find your own stress symptoms and identify those is first and foremost. Really seeing how does your stress manifest? Do you manifest your stress physically? Maybe you have body sweats or tension in your neck. Maybe it's behaviorally. You cry or yell or are short with your friends or family. It could be emotionally. You could be sad or depressed. It could also be cognitively and manifest into negative thinking. So the first thing you would want to do to identify this is really thinking about how much time out of the day do you feel out of control or stressed. That's the first step after you have identified that you are feeling stressed. Some of us don't even pause in our day to feel the stress in our lives. But really being able to identify that is that first key to being able to start building habits towards the future as a practitioner.
Well, that's some very, very great advice. I'm sure a lot of our applicants, definitely probably feel most of those symptoms that you mentioned just on interview day. And so it's very, very important to be self-aware in how we react to the different stressors around us. So knowing the symptoms of stress and anxiety, can you walk us through some coping techniques that can help us in managing that and keeping it at bay?
Absolutely. And first and foremost, I want to mention that building these habits now really can help you be a good provider down the road. So taking care of yourself allows you then to take care of others. So really being able to learn your strategies in undergrad will help carry you through medical school, into residency, and into practice throughout your life. One of the things that I do recommend is doing something you enjoy 5 minutes a day. Taking just 5 minutes and doing something you enjoy, whether it is playing a game on your phone, talking to a family member or friend, reading a book, just doing something that you really enjoy. Another thing to look at is learning mindfulness, learning how to practice mindfulness. Mindfulness is about focusing one's mind and attention, really being able to be present in your daily life. And starting to be able to do that through something called mindfulness walks, noticing your surroundings. Maybe learning meditation using something like an Insight Timer app can help you focus. Breathing techniques. I teach 5-finger breathing and progressive muscle relaxation to my JAMP students. And it definitely helps them be able to bring themselves back to the present, calm their anxieties and stresses as they're preparing for the MCAT and facing everyday classes.
Right.
And just being able to identify what works for you as a coping mechanism is going to be the next step in after you've identified your stress, trying to figure out what works for you. Not everything will work for everybody. And so it's trying different things to see what works best for me as a person, or you as a person, you as a practitioner, and going with that.
Well, that's some really solid advice. I have to give my own plug there as well. I actually use an app called Calm, which is really phenomenal. It's available at least I know, in the Apple Store, and it has several time meditation timers. It has guided meditation, and it's about 5-10 minutes that you can just take to yourself and really focus in on breathing techniques and being aware of where you are and what's causing distress. And I can say that from using that, I think I've been using that for a little bit over a year now, and it's just been such a magnificent change in being able to be a little bit more mindful of where I am, what's causing stress, and really keeping that anxiety and that stress at bay.
Absolutely. And another thing that people can do to help with stress and cope is exercise. Being able to do something they enjoy, maybe in undergrad joining an intramural sports team, or going for a 15-minute, 20-minute run before class or after class, can really kind of help take that stress out of everyday life and bring somebody back to rebalance. Yeah.
One of the students I advise, actually, he likes to do yoga, and that helps bring him back to the center. And others come back to their families and they do certain activities in that way. So there's not one technique that works for everybody, but there are several that work for many people out there, and it's just about finding what works for you.
Absolutely.
Now, you did mention the 5-finger breathing technique. Is that something you could walk us through right now?
Yes, absolutely. So to do the 5-finger breathing exercise, you're going to want to sit up straight in a chair.
Okay.
And you can really, truly do this anywhere. It takes about 3 to 5 minutes. It can take up to 10 minutes, depending upon how long you want to stop on each finger. But I'm going to take us through a very quick one that allows us to focus our mind as well as our breathing.
All right.
So first you're going to take your hand. You can choose whichever hand you want to, left or right. You're going to touch your thumb to your index finger. And as you do this, you're going to breathe in through your nose and out through your mouth. You're going to start thinking about going back to a time when your body felt healthy, fatigued. Healthy but fatigued. When you just engaged in an exhilarating physical activity. You might imagine that you've just played tennis or jogged or had a great workout. Now take another deep breath in through your nose and let it out through your mouth. Now touch your middle finger to your thumb. And as you do, breathe in through your nose and out through your mouth. And go back to a time when you had a loving experience. It may be a warm embrace or a hug. It may be an intimate conversation with a family member or a friend. And as you think of that, breathe in through your mouth and out through your nose, which is a reversal. And do it one more time. Now in through your nose and out through your mouth. Now you're going to touch your ring finger to your thumb. Breathing in through your nose again and out through your mouth. And as you do now, go back to your nicest compliment that you've ever received. Try really hard to appreciate it. Think about what was good about it and accept it. By accepting it, you're showing your high regard for the person who said it. And by doing that, you're really paying him or her a compliment. Now breathe in through your nose and out through your mouth. Now touch your pinky to your thumb. As you breathe in through your nose and out through your mouth. And as you do this, go back in your mind thinking about the most beautiful place that you've ever been. Think about what it looked like. How did it feel? What do you see? Paint a picture in your mind and dwell there for a while. As you breathe in through your nose and out through your mouth. In through your nose and out through your mouth. Now as you take your last breath, in through your nose and out through your mouth, you can open your eyes and shake your hand out. And take one more deep breath and breathe out anything you were feeling inside.
Wow. That really helped. Thank you so much for walking us through that. Hopefully our listeners were participating along and really find benefit in that.
I hope so too. It's a really good one to do, and it really can truly be done in the student union, in your car in a parking lot. It can be done at your desk, really anywhere. It can be even done in a practice before you see a patient.
Right. So Shannon, you have one more technique to share with us, right?
Yes, I do. And it is for mindfulness. And it's 4 steps that you can take. And you can literally do this one anywhere as well. But first, you're going to pause for a moment. Just stop wherever you are, whatever you're doing, and pause. Look around you and notice 5 things you can see. Now listen carefully and notice 5 things you can hear. And step 4 is notice 5 things you can feel in contact with your body at the moment. And as soon as you've gotten those 5 things, you can come back to your present moment from your pause and just notice how you're feeling. And that can be a very powerful mindfulness moment to help you focus. And sometimes I find that being able to just focus reduces stress.
Definitely.
As well. And I also mentioned progressive muscle relaxation that I teach our students that. And wanted just to say, if you go onto YouTube and type in progressive muscle relaxation, there are some amazing recordings on there that you can pull up, put in your earbuds, and do very quickly.
Thanks for sharing those. So can we talk a little bit about self-care and how important that is once we're talking about medical, dental, or veterinary practice?
Yes, self-care. I cannot say enough about self-care. Self-care is crucial. Being able to take care of yourself allows you to take care of others as a caregiver, as a physician, as a dentist, as a veterinarian, taking care of the animals and the owners. Self-care is that piece of us that we sometimes forget about as a practitioner and caregiver. And making sure to bring yourself back to that self-care and being able to, once again, do something that you enjoy, even if it's going to coffee with a friend for half an hour, caring for yourself, getting enough sleep, being able to relax before you go to bed, even just making your bed in the morning to get the day started can be a form of self-care that we sometimes don't think about. And being a good practitioner, taking care of yourself, is really going to allow you to take care of others in the best way, shape, and form you can.
Absolutely. And we always hear these tales of selflessness from healthcare providers. There's this really great story that we shared on the JAMP Facebook page about a doctor who essentially did a mini triathlon just to get to his surgery on time. And those tales are very extraordinary, but I think we have a lot of everyday heroic moments like that when we choose to put our best foot forward and present our best selves. And I think it's very important for applicants now to start setting up those habits so that down the road they can provide their best service and their best service to their patients.
Absolutely. And there's so many myths out there that we tend to buy into and tend to tell ourselves of, I don't have any time for self-care. I can't slow down because I need to see this next patient. I don't have the time. That's the biggest one that I see students struggling with in undergrad. Is I don't have the time to volunteer. I don't have the time to balance my studying, which really goes into time management. And time management and figuring out where you're spending your time, where your I call them time black holes, where your time is just going away, figuring out what those are, so then you can rebalance your time and then, in essence, give time for self-care.
Yeah. Great point. And that's a really strong myth-buster aspect that you just tackled, because there's always a little bit of time for self-care, and really being mindful of where your time is going and where your resources are going toward, and reprioritizing those so that you make time for yourself just as effectively as you make time for others, really is going to help in the long run.
Absolutely.
Well, Shannon, yeah. Well, is there anything else that you wanted to address while we still have you?
Just one last thing is, I know getting grades that you want can be a big stressor for a lot of health profession students, and just being proactive in identifying stress and being proactive when things aren't going right in classes, reaching out for tutoring, going to talk to your health professions advisor. Just be as proactive as you can and build those habits now, so then you can carry those throughout your life as a practitioner.
Great point. All right. Well, Shannon, thank you so much for joining us once again.
Thank you so much, Enrique.
All right. I'm going to cut the recording there. That was